You're listening to Searching for More, a podcast of the Diocese of Arlington. On this episode, Art Bennett, President and CEO of Catholic Charities of the Diocese of Arlington, discusses the Church's role in responding to and helping communities navigate emergencies, particularly during the response to COVID-19.
It's a great thing to know. This is the way it has been. The pandemic has been shutting some doors, and then it opens a door over here on the side you didn't even think was there.
Hear Art Bennett shed light on the many ways the local church helps those in need during these uncertain times. This episode's host is Billy Atwell, Chief Communications Officer of the Catholic Diocese of Arlington.
Thank you for joining me on the podcast.
Well, thank you, Billy. It's an honor to be here.
So you've been with Catholic Charities for 10 years, is that right?
Right.
Very cool. So you've seen a lot of different things, needs come and go, more probably come than go, but what we've dealt with COVID-19 over the last several months has certainly created a unique strain, but also opportunity in the way Catholic Charities serve. So I wanted to have you on to discuss a little bit of that. I'm behind the scenes sometimes to get to see these things. I'm like, more people need to know, what's happening here. And the needs are spiritual, the needs are emotional, but the needs are also physical. And that's where Catholic Charities comes in as our kind of social service arm of the church, the social ministry of the church. Talk a little bit about as COVID started setting in initially, and there were, schools were shutting down, and then there began these layoffs and things. What were the initial strains placed on Catholic Charities in terms of need? What was the greatest need that was coming from the community?
I think the biggest need that came from the community was the real fear people had of losing their jobs or getting a disease that could kill them. Mm-hmm. And also, if you lose your job, then the cascading of, can I pay my rent? I lose my medical. So I think there was a real high anxiety. And also, if you remember, I guess it was about 4 months ago, we really didn't know what to do or how we could engage or whatever.
Yeah.
But because of our mission is kind of unique in that it's providing charity to people in need. We've never seen it as circumstantial or dependent upon certain conditions being fulfilled. We've always thought, we have to be charitable for people who need help. But I think the good move we made that kind of got us over the hump a little bit, and this was also reinforced by some things Bishop Burbidge had said, was that you can only go as far as safety will let you go.
Yeah.
So there were some people on staff and stuff who said, we're in a service organization. We need to do whatever we need to do. I don't mind taking the risk or whatever. And then there were some people who said, we can't do anything. it's just too risky. So we really highly emphasized that we will only move in concert with safety. And then, of course, the protocol started coming out from the in this case, the Commonwealth of Virginia and stuff. So you had to conform with those and everything. So I think that gave us some reassurance that, we have a mission that we really have to figure out. We can't really shut it totally down. We did shut down some programs because they were unsafe.
Yeah.
But you don't turn off charity, just like in a marriage or in a family, just because you're busy or you're tired or whatever. You don't say, I'm going to stop loving my wife for a couple of weeks while I take care of business. You just don't do that. So we saw that. We have to be charitable. We have to figure it out. But whatever we figure out, it has to be in conformity with safety.
Yeah.
So that was, I think, the key thing. So then we went as far as safety could go. Now what happened in some cases, Billy, is we had to totally redirect what we did. I'll give you an example now. You and I are talking right now, but we had a lot of talk stuff going on, and a lot of engagement and counter stuff, like counseling or attorneys talking to clients that are trying to figure out their immigration status and stuff. Our teaching classes, so we had to abandon all those methods, and then we had to go online and do virtual and. Grace of God, so far that's worked out pretty well. I have to say, if you talk to our psychologist or therapist, they'd say, the virtual is not so good with little kids. Like if you're talking to a kid who's depressed or anxious, that's not really working online. So you can talk to the parents. So that's a miss. You can't really talk to the kid like talking and playing. But overall, we feel that we've been able to provide a service that helps people online.
Yeah.
So that's a big thing. Now, there are some programs that are not online friendly. Evening meal for the homeless at Christ House. You can't show pictures of food. I think it'll work.
Virtual meals don't work out, as it turns out.
Virtual meals don't work. We've been doing that since 1974, and so we had to adjust to that being a takeout and do some safety features. We had a mental health clinic, a health clinic in Manassas and soon Woodbridge. People coming in sick, so we had to figure that out. How do you let people come in who are not feeling well without causing increasing the pandemic and the fear and stuff. So we thought we had discovered actually we could do a lot of stuff online.
Every doctor's office was facing that too. I mean, everyone was trying to, doctors' offices can't close down, and neither can our free, health clinic. Those are, and because the people coming into like Mother Mercy, for instance, they are people who are in a lot of those kind of essential roles, and they were the first to come back. Some of them never teleworked, based on the nature of their job. And so they were always out there, and then therefore always exposed.
Right.
And what was your experience? Because I know a lot of the groups that we serve, or the individuals that we serve, are racial minorities. There was a disproportionate exposure rate in those communities? How did that emanate kind of within the clients that Catholic Charities serve? Did you see that same trend continue, or how did that go?
Well, we saw it, and we worried about it quite a bit, because clearly we were seeing people at our free clinic. Let's take our free clinic in Manassas, which is really only for people who have no insurance.
Right.
So they have jobs, and most of them have jobs, but they don't have any insurance. And they're also not the kind of people that can just call in and say they're sick and expect to have their job the next day. They have very little security. So they're kind of propelled to go to work even when they're feeling sick. They oftentimes don't have their own apartments. They have to share with a bunch of other people, some strangers, some extended family. And then they take the buses and rapid transit and stuff. So they were high risk. They had a lot of high risk features. And yeah, they would come to our clinic for help. So we had to do something that was kind of hard. We had to be very strict before they crossed the threshold of coming into our clinic, because we didn't want anyone else to get sick. Mm-hmm. So I'll give you an example. A mom came one time and she was feeling poorly, but she was also pregnant. And we do see pregnant women in person, because there's no way of doing a sonogram without the person coming.
Right.
She came in with her little child, and we said, "Oh, listen, we told you this. We can't see your child at this time. She's not sick. So let's reschedule." So in this case, we just saw her a couple hours later. Somebody came and picked up the child. So we had to be kind of strict that way, which would never be before. But we were always looking at the client in front of us, and we're looking at our staff, and then the hundreds of people that might come in after them. So we found a way to do it. But again, we found that by being hypersensitive to the safety, it actually opened more doors than closed. Yeah. So that was an example of that. So once we kind of had the safety first, but not a kind of overly anxious safety, but safety protocols. And you remember those days in March, April, they were changing all the time. CDC said, wear mask, don't wear mask, wear mask again. We were just trying to keep up with that as best as everybody else.
And the death rate, how contagious it was, that was changing constantly. Now we know more. Back then, it was like everybody was a risk factor. There wasn't clear that these categories, mattered as much as we thought.
Yeah, that's right. So it was hard, but we realized that by being safe and a little bit tough, we could help more people. So it kind of worked out.
Yeah.
It worked out, yeah.
How many programs does Catholic Charities have right now?
We have 22 programs, and 22. I think all but one of them is open.
That's amazing.
Yeah. We did have our thrift shop closed for about 5 months. We just couldn't figure it out. It's a tiny little place.
Yeah.
How we could social distance that. Now we figured it out, and we have protocols for only a certain number of people coming into the store. Stuff we take for granted now.
Yeah.
In March or April, you go, "What are you talking about? I can't come in," so just shut
Right.
the thing. But overall, we've been doing, I think, really well. We categorize our programs in 5 areas. Emergency programs like food, that's never shut down. We've always given food every day. We've been around. And the things that have really increased, Billy, people who are threatened with evictions.
Yeah.
And people who are threatened to have their utilities shut off because they don't have a job, they can't pay those bills. So we have done a ton of work in that, much more than we had ever before on that. And then there's what we call kind of human dignity work, like prison ministry. We can't really go into prisons now, and we can't do much of that. That's a problem. But we have adoption programs. We're still able to do that. A lot of that can be done online. So
good.
Yeah. And then we have refugees and immigrants and workforce development. And we really had to change our classes. Our classes used to be in person, sometimes at parishes. Now we've gone online, and given the power of the iPhone, which pretty much everybody has,
mm-hmm.
We're able to do a lot of classes that way and make the adaptation and things like that. So our housing, every single person we had in our homeless shelter in Christ House, all 12 of those men were laid off right away. Boom.
Wow.
They had inessential jobs. And then at our home, St. Margaret of Cortona, for homeless families, which is really single moms with kids,
right.
They were all laid off. So they were all laid off right away. So that whole notion of you're on the bottom of the org chart, you get laid off, the answer is you do. So, because of our stability as an organization, we were able to keep them there. we required them all to work. So
Right.
we had to help them get back into work. And now today, almost all of them are back at work. So
That's
here we are
wonderful.
4 months later. So that was because we had the safety net of having them in Catholic Charities could help them. They didn't get thrown into the street or under a bridge.
Yeah.
And were able to be helped. And so that's worked out. And then healthcare. I've talked a little bit about the free clinics and mental health. Mental health. I mean, everyone experiencing more anxiety. You can be really healthy because the anxiety is real. The problems are real.
Yeah.
And we had to shift that totally online. And then last June, I guess now 2 months ago, was not only the busiest June we've ever had, it was one of the busiest months we've ever had since Catholic Charities have been keeping track of that. So because of the online feature, we have less cancellations. People don't get stuck in traffic.
Yeah.
So we've actually had the utilization go up and the requests go up. So that's been some things. I don't want to say some things. I guess I could say that some things have gotten better in terms of access. If people are comfortable with Zoom, Zoom will never replace face-to-face, but it's a lot better than nothing. A lot better.
Yeah.
In some cases, it can really be helpful.
Yeah, telemedicine, teletherapy, those have obviously boomed. When we let's imagine a world where we kind of get past COVID to an extent. How much of this do you think will be maintained as part of Catholic Charities function in terms of like the tele-whatevers? We've gone online with a lot of things, but like you said, not everything should be online.
Right.
So, but how much do you think would be retained long-term for the efficiency and traffic and everything that you mentioned?
That's something we talk about all the time. I'm sure you do too. I'll give you an example. We had an event last night. It was a discussion on racism, which is very important to Catholic Charities because there's a concomitance of minorities and poverty. We have to just address it. So we hosted it at a parish. The parish could hold 100 people safely, so we had 100 people in those spaced out chairs. 100 people is a good crowd for a parish event on a Tuesday night.
Exactly right.
We had Bishop there, that helps. Okay, so we had 100 people there, we turned some people away. But online we had 1,100 devices paying attention. So you could say less than 10% were there live. So here we have a situation. Now again, we're in Northern Virginia. You're sitting at home on your couch watching this. It's high quality. The talks are good. I don't know. That's something, your communication, I'm a Catholic. We have to think through. We got 100. That's a good crowd. But that's not the same as 11 or 1,200. And then I was talking to your guys who recorded it. How many people does 1,100 devices mean? And we were kind of taking some guesses at that. But I think what you have is the live audience was about 10%, maybe less, of those impacted. That's a pretty cool thing.
That is, yeah.
So for those of you sitting at home, turn it on and learn from it. From those of you who are more want to have the event, so I don't know. It's going to be hard to turn off that live streaming.
Yeah, I think
numbers.
so. I mean, and we're trying to figure out, where is it appropriate to live stream an event? Where shouldn't you? I mean, we're kind of finding that line out as we go too. But the ability to do teletherapy, especially for someone who is maybe apprehensive about getting into it at all, they might feel comfortable being at home and having that barrier that's a little bit impersonal. That might help kind of open them up to getting in full steam. Or if there's an event where they're not totally sure where they are on the issue, or they're not even sure if the church is right on the issue. Well, it's good. It's a good opportunity. It's like a subtle evangelization to have it out there where they can just sit in the background. No one knows they're watching, and they can just observe and take that in. Yeah,
so you're hitting issues of comfort. It's more comfortable to watch at home, and you're right, by the way, if you've ever been to counseling, I've been a few times, that walk across the driveway into your session to talk about problems, you're open for distractions if something would get you. But let's say the other side of the coin. Let's say I live in Lorraine. Let's say I live in Kilmarnock, and some people listen and go, where are those places? They're in our diocese. We're responsible for them. Well, they really can't haul in to all the way up to Fairfax or even Fredericksburg. I mean, they could, but they're going to have to eat up half their day.
Yeah.
Whereas they can just go online and get help. So in one way, the reach for helping is much broader. Access is better.
Yeah.
In some ways. So we're learning from this. I don't know. I see the future more like a hybrid.
Yeah.
A little bit of bet. But after last night, that makes us wonder when we have a great crowd and it's only 10% of the people. There's a lot of more. It's tempting not to shut down that online thing. We're all figuring it out. We're trying to figure it out.
Yeah.
But there's a lot of different audiences and a lot of different
So you're talking
needs.
about kind of an expanded need. Obviously, some of it's just financial because people are losing their jobs. They need food. They're going to be evicted. Those kinds of things. Well, at the same time, are you seeing donations increase? Because obviously the needs are going up, and we put out a graphic that was like $2.4 million worth of service and food and so on was distributed between the parishes and Catholic Charities. I think it was like 1 or 1.1 was Catholic Charities alone, which is incredible. Yeah. How are you all balancing out the needs that are out there that you're filling with the faithful responding and donations? How is that balanced out?
Well, it was preceded by a bit of a crisis, I have to be honest, because you don't get more creative in crises, particularly when you just have to produce. So what happened was the needs went way up right away. We got more calls than we'd ever gotten on evictions, utilization. I need a job. I don't have a place to stay. I'd have no medical care. So the spike went way up on needs. But went down was the place that really kind of supports Catholic Charities the most, which is called our Catholic parishes. Mm-hmm. They weren't able to have Mass, nobody was coming. So that was the crisis that we as an organization had. So we decided we had to ask more. So we started putting out emails and contacting donors and stuff. So we had to change our behavior to just ask, because people were asking us for help and we couldn't deliver it at first. And Billy, and this is something people don't really understand sometimes about the Catholic Church or Christian religions in general. The generosity, it's hard to underestimate it.
It is.
People really responded. So we got in the habit of sending out an email every Saturday saying, here's how the week has gone. Here's kind of what we've been doing and what we're trying to do. This is the request we get. And then we would come back to work on Monday morning and see what happened online. I have to say, sometimes it was in thousands and thousands of dollars that came in over the weekend when people saw those emails. Now, your communication team was part of that. So that's another thing. We had to team up with communication experts like you guys, and we can talk about the needs. The response was unbelievable. The other thing that happened, kind of didn't see it coming, was a lot of the county governments turned to us. There's a little bit of a tense relationship sometimes between county governments and Catholic Church. We don't always align on all the values. We align in many of them, though. And where we overlap, though, is helping the poor, helping the sick. So they turned to us in ways we've never seen before. They saw us as a reliable agency who has access to the people in need, we do, and has a good track record of helping people, which we also do. So we had some new partnerships there where they said, listen, we want to dedicate, we don't want a bunch of homeless people in our county, because that's a nightmare for everybody, not just the homeless people. And so we helped them with that. So they'll call us, give us more resources. So we had a lot of partnerships. So it was really extraordinary that the need went way up, but so did the generosity. And
it's not just that you guys do the work and you have access to the clients, it's you do it incredibly efficiently. I mean, that's the thing, is when you compare how we do it with others, government included, it's striking how efficient we can be with that. And that's a testament to the staff and the volunteers that are helping deliver these services. How has all of this impacted the staff and the volunteers? Because we've had volunteers on the front lines. You don't distribute food via robots, not yet. We're a few weeks away from that. But so we have volunteers and staff all throughout the crisis, helping those women at St. Margaret or Cortona, helping the men at Christ House, making sure the food's available and distributing it. How is this impacting them?
Yeah, well, first of all, thank you for your compliments on our efficiency. That's great to hear. Well, to be honest, that has been hard. Volunteers are wary. Just like all of us, they're wary of going into compromising situations. And some of our programs that we've kept open, like the clinic. The free clinic means sick people come in. That's what a clinic is.
That's the nature of it.
We lost a lot of volunteers at that. Now, again, these are great people. They'll come back, but I could get it. Also, a lot of volunteers are in their 60s and 70s and stuff. They are a high-risk group, and in a way we can't even allow them to come in. That was a real challenge. So our three busiest programs, let's say Christ House, St. Lucie, and the clinic, lost a lot of volunteers. So that was another crisis we had. So what we could, we went virtual. Some of our meals, we handed out meals. It only takes one person to hand out boxed dinner, whereas if you have a dinner, it takes like 9 or 10 people to serve, clean up, and everything.
That's a good point, yeah.
So we were able to take advantage of that and also have flexibility on that. But thank goodness, some staff had to work a little harder. I have no doubt about it. But we did lose volunteers, and they're coming back now as it gets safer, as we can convince them and ourselves that it's safe. They're coming back. But that was something that was a real crisis for our programs that are open. Now, some areas, like once we stopped having in-classroom classes, and we said we only want teachers who want to teach virtually, oh my God, we got a flood of that. Some people say, I love to do online teaching, or that's my wheelhouse, or that's great. I don't really want to drive to a parish and park. And you say all these convenience factors.
Yeah.
So all of a sudden then we got more volunteers. But when it comes to people face-to-face, we had a volunteer shortage, and it really did tax our staff. I would say 3 of the best leaders I've met in my, 40 years of management are the people that were running Christ House, Mother of Mercy, and St. Lucie Project. They had some tough times, but
no doubt.
Convinced you to stay open, but it was not easy. So I'm not going to romanticize that. It was tough.
Yeah.
It was tough, but I think we're managing pretty well now. Yeah.
Yeah, it's interesting that the virtual volunteers that increased. We wouldn't have known that if this hadn't happened. This is where kind of like, God shines a light in strange circumstances sometimes. But that's good to know. I mean, as you go forward, to know that if we can make something virtual, we're going to have a higher volunteer response than if we have to do it in person. That's a good thing to know.
It's a great thing to know. This is the way it has been. The pandemic has been shutting some doors, and then it opens a door over here on the side you didn't even think was there.
Yeah.
We had a prayer service at Saturday morning at the cathedral maybe a couple of weeks ago with Bishop Burbage. It was also related to some racial issues. We had about, 60 people there. Not a bad crowd, Saturday morning. But then we discovered like 600 people on virtual.
Yeah.
So maybe they're watching in their pajamas, or maybe they're in between whatever task they had that day. These are things we have to think through.
Yeah.
And we're a religion that is very, we're a sacramental religion. We're a touch religion. So we have to think this stuff through. But there are some areas where it has become more convenient for people, and some areas where it's been less convenient. We're still sorting this all out.
Yeah.
It's
a benchmark in human history, that's for sure.
Yeah.
This is an important time period. Yeah. I want to go back to the point about donors. You have a few numbers in front of you. Would you share some of the figures for those that didn't see the infographic and the Herald, just in terms of like what the kind of the dollar investment was in the poor and the vulnerable?
Right, and we're really talking just about a March, April, May, June, July, so a 5-month period here, not even a whole year. We gave over $1 million out for rent and utilities. I could talk to a donor today. I thought there was a moratorium. Well, sort of eviction moratorium. There was sort of one, but there was no forgiveness. It just meant you can kick the can down the road, and at some point you have to pay that rent, and that's kind of where we're at now. Yeah. So over $1 million. Again, wow. Everyone is trying to do everything they can to keep a family and a person become homeless. A homeless person is a tragedy, but it's also very expensive. So we got $1 million to help with that.
Yeah, and I would think too. These are people that aren't, they didn't get fired for showing up late or something. It's like these are people in service industry, dual income households almost all the time.
Right.
And they're barely hanging on when they're at full pay.
That's right.
They miss a day of work, they're behind immediately. And that's who we're trying to help. Because a big part of the model for Catholic Charities is helping people so that they don't need us later. It's giving them everything they need now to equip them, get them on their feet, and make them self-sustaining.
Right, that's what we call the transformation thing.
Yeah.
As you come out of the encounter with us as a different person, able to pull yourself up and have more options and hope. But of course, the flip side with the pandemic, we had people who had been donating food to us now coming to ask for food. And that took tremendous humility and probably from their point of view, humiliation. But they just couldn't make it work. Or if we help them with groceries, then they can pay the electricity bill or get their kid shoes for school or something. So it became very, very difficult for a lot of people. $1.1 million in food we gave away. That was really amazing how many people asked us for food. Medical assistance, almost $200,000 of free medical care. But we have a free clinic, but the numbers were pretty high. So we figure we served over 101,000 people in 5 months. And that's like 2.5 times what we normally serve. So it's been...
and that was just over that, was it 3-month period?
5-month period,
yeah. 5-month period,
yeah, but concomitant, we mentioned some of the challenges with volunteers, but really the story, though, is the radical generosity of people to help us out. The people that could help us out were just doing it. And people, I give the thank you notes to people, and I'm so amazed more often than not, they're giving us more than maybe they've given to us occasionally in the past, but now they're giving us like 2 or 3 times what they used to give. So that's the other side of the story is there's a great crisis, But there's radical generosity too.
Yeah.
Radical generosity that we.
And the needs are growing, and the needs are continuing, especially with school starting. That's a cost for people in terms of supplies. And with so many counties, so many public schools being virtual, that means one parent has to be home with them. So this is, again, dual income households are now single income.
You might have to buy another computer depending on the county you're in, or a laptop for your kids. You say, who budgets for that? Nobody. There's a lot of challenges on that. They may work themselves out, but you're right. A lot of extra expenses. Yeah.
What is your message to those who would consider giving to Catholic Charities? They haven't yet. They're not a current donor necessarily, but they're hearing these needs and they're trying to kind of get their minds. Like, what would be your kind of elevator pitch to them about what happens with those funds and why it's important to contribute?
I mean, we have an outside auditor, so people that pay attention to money, 85% of every dollar we get goes directly to people. That's a great number, the auditor says.
Incredible.
So it means 15 cents goes to the management and oversight, but 85% to people. So that's a good number. We're proud of that. It's an auditor's number. I would just say that, and this is part of the reason the governments and counties have turned to us is we've actually been helping people on the margins a long time. So we know how to get to them. They come to us. So I think we're really efficient with that. We're not spending a lot of money hunting for problems. The problems are coming to us, and then we've been doing this a long time. It's a little bit more intense now, I have to admit. It's a little bit different, but it's more like what we do on the day-to-day. Same thing, if you go to a restaurant that's never served people outside, they're kind of bumbling it. They're trying to figure it out. But if they've had outdoor seating the whole time, they're in the swing. I guess we're kind of more that way. This is a pretty typical, in many ways, this is more typical for us that we're seeing people that are on the margins and in trouble. We're also pretty good I think at sniffing out people that aren't really in trouble. They're just taking advantage of a situation. We have a lot of experience with that. And we're, like you said earlier, we're trying to be transformative. We're trying to take them from wherever they are to wherever they need to be. And the other thing too, we have partners. We can partner with the parish. Maybe we give half the money, the parish gives half.
Yeah.
Or we can work with a different government agency. So the money can go a little farther. And then we know things like you don't actually give a check to somebody. You send it to the utility company or send it to the landlord. These little things that.
Yeah.
So you know your money is going to go to a transformative activity, and you can check our website out and judge
and that's
for
where that
yourself.
Administrative side, so 85 cents go directly to people. Well, if that goes, sometimes if that 15% gets smaller, the amount that's being distributed is being used less efficiently. You need an administrative part to verify that they're a person in need, that the money's not going right to them directly, like you're saying, it's going to the person, the landlord, or to the utility company or whatever.
Yeah, I've just
you need administration in order to make sure the money's used well.
That's right. I've been evicted. Okay, can you show us the lease? Let's take a look at the lease, make sure it's not like the same last name as you have. It's not your brother who's the landlord or something. We have to verify all that.
That's a great thing to verify, though. I mean, just as a donor, it makes me feel good to know you're taking such good care of the money. I mean, and I know a lot of people that give to Catholic Charities do it so confidently because they know how you guys take care of it like that.
Well, that's kind to say, but we're audited and we're open and clean. But I think that's part of what a donor would see and stuff, that we have access to people that need help. They come to us, and overall we're able to help them. Yeah.
Is there anything I missed that I should have asked you about that people should know?
Well, the only thing I always like to say about Catholic Charities is we're not just a typical public service agency, though we do. I guess sometimes if you watch what we're doing, you might think that. I mean, really, this is all an extension of the love of God.
Yeah.
That's what motivates us. We see, just like we see charity is a transcendental, supernatural thing, we see faith and hope that way too. So we don't really allow ourselves to turn those buttons off. They're on all the time. But really what it is, it's the love of God, and he doesn't abandon his people. And we believe that greatly. And, that old adage out of St. Matthew that if you have faith, you can move mountains. We feel like we've moved some mountains in helping people here. But really, it's just the generosity of God and his willingness to really show charity under all circumstances. So I think that's a key part of Catholic Charities. It might differ from other nonprofits as well. And so I just want to make clear on that. We're trying to do it from the love of God. Just extension of the love of God, co-workers for the truth.
That's been a wonderful thing. I've only been here for 3 years, but to see that our Catholic Charities agency really does begin with the teachings of the church and the gospel, and that's the starting point. And out of that emanates this love for the poor and the vulnerable and those in need, and all of the ministry carries from there. That is the starting point.
Yeah. I'm saying that I should highlight that we serve anybody. Sometimes you always just serve Catholics. No, we do it from a Catholic perspective of radical generosity, and but really the impetus comes from, I think, the Holy Spirit, and it keeps pushing us forward. And so happy to ride that wave. It's been, so far, people have been real generous. We're not terribly surprised, though we're really grateful for it. And maybe we can just keep on keeping on to try to help people through the different challenges. It seems like there's more challenges ahead.
Yeah.
We're really concerned about more layoffs.
Yep.
How long can people be held in employment when they're not doing that much? So we're trying to get ready for all that the best we can. Yeah.
Very good. Well, if you'd like to learn more about Catholic Charities, go to ccda.net. All of the statistics that Art's taken you through, and any of the articles, the stories of the witnesses of faith that have happened through the ministry of Catholic Charities can be found there. And you can also learn how you can contribute or support Catholic Charities. If you're one of those people that you want to volunteer, you want to help out, you go there and you can learn how to help. Art, I want to thank you for all the work you've done. I know your staff have been leaning in and burning both ends of the candle, but you have too. And I'm just so grateful for the leadership that you've offered throughout this pandemic. It's done a tremendous, more good than you could know. And luckily in communications, you get to tell those stories. I think of you in each one because I know your fingerprints on them.
You
so
have a
thank you.
communication department that likes to share good news, and so thank you for that too.
Well, you make it easy because you provide a lot of good news.
Well,
Art, thanks again.
very kind. Thank you very much. It's been a delight.
You're listening to Searching for More. If you enjoyed this podcast, please write a review on iTunes, Google Play, Stitcher, Spotify, or wherever you listen. Also, make sure you follow the Diocese and the Arlington Catholic Herald on Facebook, Twitter, and Instagram. And subscribe to our YouTube channels for regular videos that inspire, educate, and inform about the Catholic faith in our diocesan community.